Greetings. I'm Dr. William Lanier, Professor of Anesthesiology, Mayo Clinic in Rochester, Minnesota, and Senior Author on an article entitled Medication Errors, an Overview for Clinicians that will appear in the August 2014 issue of Mayo Clinic Proceedings. The first author on this article is Dr. Christopher Wittich, an Associate Professor in the Department of Internal Medicine, and co-author is Dr. Christopher Burkle, Associate Professor in the Department of Anesthesiology. The purpose of this article is to provide a review for practicing physicians that focuses on medication errors. This article will review terminology and definitions of medication errors, as well as the incidence, risk factors, avoidance strategies, and disclosure and legal consequences of medication errors. One of the reasons for concern is that medication use in the United States is highly prevalent. A recent large national survey determined that 80% of people in the United States took a medication in the preceding week, and 50% took at least one prescription medication in the preceding week. Medication errors are common and are defined as any error that occurs at any point in the medication use process, whether involving those who prescribe, dispense, acquire, or use those medications. Confusion can occur at any part in the cascade, and errors can be introduced at any part in the cascade. For example, in a survey of hospitalized patients, only 28% could list their discharge medications, and even fewer could state the intended use for those medications. Similar confusion and errors can occur elsewhere in the cascade. Medication errors may or may not result in an adverse drug event. An adverse drug event is defined as an adverse outcome that can be attributed to the action of a drug. Medication errors may escape unnoticed, or they may have consequences as a result of the aforementioned adverse drug events. The Institute of Medicine has estimated that medication errors cause 1 of every 131 outpatient deaths and 1 of every 854 inpatient deaths. Medication errors and the consequences can depend on the type of medication being employed. Medications most commonly associated with errors include the insulins, opioid-containing analgesics, anticoagulants, amoxicillin-containing agents, and antihistamines or other cold remedies. Patient-related risk factors can also affect medication errors. These include declines in renal or hepatic function, impaired cognition, other comorbidities, and polypharmacy. Healthcare provider-related factors include the use of abbreviations, which may be illegible or misinterpreted, cognitive biases, or other factors. Efforts to avoid medication errors include computerized physician order forms, barcode-assisted administration, improved drug packaging and labeling to avoid look-alike or sound-alike mistakes, and medication reconciliation. Despite all of these efforts, further research is needed to determine which of these will meaningfully affect outcome and which will not. The disclosure and legal consequences of medication errors include issues related to patient trust, medical board discipline, and potential civil and criminal charges. Advice is provided within our article as to the proper ways to disclose and share with patients information on medication errors once an error has been discovered. In closing, we hope you enjoy this article and find it informative and useful to your clinical practice. Again, this article can be found in the August 2014 issue of Mayo Clinic Proceedings. Thank you. We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.